Okay, now to the mask mandate for LA County healthcare facilities that the Public Health Department quietly reinstated Friday due to rising COVID hospitalizations. A doctor at the county's largest hospital says COVID isn't causing severe disease and the numbers don't paint an accurate picture.
Yes, there is COVID, there is influenza, there is RSV. They are causing upper respiratory tract infections, generally mild. They are not resulting in significant hospitalization rates at our hospital. We, of course, do not test all admissions. We only test symptomatic people. There are other hospitals out there, for whatever reason, that are continuing to test all admissions, which makes the numbers of hospitalizations appear artificially inflated. I don't know why that's still happening, but it is. So that's driving a lot of the concern. So everybody just relax. We're going to be okay.
That's Dr. Brad Spellberg. He is the Chief Medical Officer at the Los Angeles General Medical Center. He says COVID is endemic. It is here to stay, just like flu and RSV, so we just need to live with it. With more on the reinstated mask mandate, we are joined by our medical roundup board-certified ER doctor, resident doctor, I should just say, Dr. Michael Daignault. Thank you so much. Happy New Year.
Happy New Year to you.
It's our first segment of the new year.
No, it's so exciting.
Let's start with the mask mandate. You just heard Dr. Spellberg's take. What's your take on it?
I agree with a lot of what he said. I mean, we're certainly seeing increased numbers of people coming to the hospital that may be asymptomatic that test positive, and COVID is not leading to severe illness or requiring a lot of the staff and hospital resources that it did earlier in the pandemic. But, you know, from an ER perspective, when I look out into a busy waiting room and I see half the patients coming in with cough and fever and symptoms of viral illness, and a lot of these patients are elderly or they're there for other reasons, and there's younger people there with the viral symptoms. You know, it looks like a situation where they could get sick very easily just because the waiting rooms are more crowded, our volumes are higher. And so I can understand having a mask requirement for people in the waiting room or the ERs specifically. And the second reason, you know, we want to keep our staff safe. I mean, even prior to COVID, when things would go up as far as flu, we would just decide to wear a mask on our own just to keep ourselves safe, to keep our staff and our patients safe. So from those two reasons, I think it's not a bad idea when the viral respiratory virus numbers go up, just to start doing that.
My thought is, and the idea that you just brought up, that prior to 2020, the fact that there was never any mask mandates that were in place. We had flu, we had RSV, now we have COVID. It is endemic, thank goodness it's not causing the severe disease. That's a huge relief. And there were no mandates. So we'll see what happens. We'll see if those numbers, though, continue to rise because they went into the medium level on Friday. We'll see if they hit the high level. Let's hope not. Let's get to spring as soon as we can and make sure we can stay healthy. Okay, let's talk about, you have some hacks. We love hacks, don't we? To be fit and to be healthy in the new year. Let's bring those up on screen so that our viewers can digest these hacks. What are they?
So I love these. I think everybody tries to do very dramatic things at the beginning of the new year, but there's actually some pretty basic things that everybody can start doing right away to increase their health and wellness. And so the number one thing is the early morning sunlight. So before you do anything in the morning, get outside, get the sunlight on your eyes. That sets the circadian rhythm for the day. It actually leads to better sleep at night. There's some evidence that vitamin D helps fight off viral infections, as we were just talking about. If you can't get that early morning sun, the one supplement I do recommend is vitamin D, 5,000 units every other day. Really makes a big difference. Everybody always talks about getting into a new exercise regimen. The most basic thing I tell my patients, look, if you're just starting off, 10 minutes of walking after dinner is the easiest, best thing you can do. You can do it with your family. It really helps regulate your metabolism, especially those who are diabetics. And then you want to have a good wind-down regimen at the end of the day. That means turning off your phones, your computers after dark. If you need to work at night, wear some blue light blocking glasses.
And then, before we let you go, because we're running out of time, let's throw up the last few. Keep the bedroom cool. That is your tip. Lift weights for that bone density, I imagine. And then keep up to date with key cancer screenings, whether that's colonoscopy, prostate
mammography. And lung cancer screening if you're ever a smoker.
Okay, that's right. That was added that made headlines.
That was a new one
this
recently.
I got my mammogram yesterday.
I saw that.
Yeah, so I am a proponent of that. Thank you for raising awareness. Okay.